Few images generate stronger reactions than hospital beds in corridors. For many, it's a symbol of a health service in crisis, and it's one that cuts through. A relative of mine recently told me, yes, I'm a bit worried about this health issue, but I don't want to go to hospital because they'll put me in the A&E. And I know from previous experience that means the best part of 24 hours in a corridor. And they weren't wrong. Politicians call this a crisis. They call it unacceptable. Hospital leaders call them unsafe. The doctors say that it's completely unacceptable. But what if corridor care isn't simply a sign of failure? What if it's by design? The NHS has faced increasing pressure for years. Britain's population's growing older, more people are living with multiple chronic conditions, demand for emergency care rises. At the same time, hospitals operate with finite budgets, finite staffing and finite space, even if they're all growing. Successive governments have tried to stop beds in corridors, but many hospitals plan for it. It's not that they've run out of capacity, it's that they've built it into capacity. It's not an accident, it's a structural part of the design. And I won't say the buzz phrase because each hospital probably has it, certainly each trust has a different name for it. The truth is, as budgets have risen, NHS beds have fallen. There are restrictions because there's only so many beds to put them in, so you put them in the corridor, and A&Es are designed with corridors next to them often so that the beds can be put in there, and they count them as part of their capacity. This isn't an accident, this isn't an overflow, this is not a plan B or a pressure relief valve. So I was surprised this winter when there was very little debate, and last two winters really under Labour government, there was very little mention in the media of hospital beds in corridors. Because it's policy. No one might admit it's government policy, but hospital trusts design their capacity around putting people in corridors. It feels to me like hospital capacity hasn't been long-term planned to line up with population growth. I said this to a left-wing friend a while ago, and he said, "What do you mean the population of London hasn't increased?" "Not by much." Well, the number of A&Es shrank horribly, and the number of beds didn't rise, where the population did rise substantially, and that's just the official one. Rather than showing shock every time that they choose to talk about beds in corridors, maybe we need an honest debate around NHS spending, hospital capacity, what's an emergency and what's just par for the course.